All right, welcome. Today, we're going to crack the code on a really fascinating and, let's be honest, kind of complex area of medical coding, intracranial neurostimulators. Getting this right is a huge deal, and it's a skill that'll really set you apart. So let's just get right to the heart of it. A surgeon implants a brain stimulator. Simple enough, right? But for you, the coder, the million-dollar question is this. What's considered part of that procedure, and what can be billed as an extra charge? Answering this question correctly is honestly the entire game. Okay, first things first. Before we can figure out what's included or not, we have to know what codes we're even talking about. Let's build our foundation. Your starting lineup, your home base for all of this, is the CPT Series 61850 through 61892. These are the codes for the actual implantation of the neurostimulator. Just about everything else we're going to talk about either gets bundled into these codes or it's a specific exception. Now, here's where it starts to get really interesting. We need to talk about the package deal. See, a big procedure code like these, it's rarely for just one single action. It's usually a bundle that includes all the necessary little steps to get the job done. So, what's actually in this package? I want you to think of the main code like a combo meal. The test stimulations they do to make sure the electrodes are in the right spot and that the whole system works, yeah, that's your fries and drink. They're essential to the meal, so they're already included. You don't bill for them separately. Same thing goes for any electronic analysis or microelectrode recording that the surgeon does right then and there during the surgery. It's all part of the main event. And that really is the key distinction you have to make every single time. On one side, you've got the package deal, all the stuff that's just a natural part of the surgery, done by the surgeon. But on the other side, you have the a la carte menu. These are genuinely separate services. Maybe they happen later, or maybe they're done by someone else. Let's dive into that now. Okay, let's talk about that a la carte menu. These are the services you can and should code for separately. As a coder, your job is to be a detective and spot these in the operative report. A perfect example is any programming or analysis that happens after the surgery is over. The patient goes home, then comes back for a follow-up to get the device fine-tuned. That's a totally separate encounter, a different time, a different service. So of course, it gets its own set of codes. If you see this documented, that's your cue to bill for it. Now, this next rule is a huge one. It's not just about what was done, but who did it. So picture this. The surgeon is in the operating room, implanting the device. At the very same time, a different specialist, say a neurophysiologist, is there doing complex brain mapping. Well, because that's a second provider performing their own distinct service, their work is not part of the surgeon's package deal. They get to bill for their time and expertise separately using codes like 95961 and 95962. So always be on the lookout for a second provider in that OR. Okay, we've gone through a lot of rules and examples. So, what is the single most important thing you need to take away from all this as you continue your studies? It's this, right here. Your job isn't just to be a code finder. No, you're more like a detective. You have to read the clinical documentation, understand what actually happened in that room, and then make the call. Was this service just a standard part of the main procedure, or was it something extra, something that stands on its own? That's the mindset of an expert coder. So let's end with this question for you to think about. You've got the framework for neurostimulators now, but how can you apply this same logic, this package deal versus a la carte thinking, to other complex procedures? Because I promise you, whether you're coding cardiology or orthopedics, you are going to see this exact same principle over and over again. Getting the hang of it here is going to make you a much stronger, more versatile coder down the road. So next time you get a complex case, just ask yourself, what's in the package?